Misoprostol is a synthetic prostaglandin E1 analog, originally developed to prevent gastric ulcers, particularly those caused by nonsteroidal anti-inflammatory drugs. Over time, its use has broadened significantly to include various obstetric and gynecological applications. In the gastrointestinal system, misoprostol is used to prevent NSAID-induced gastric ulcers. It is especially important for patients at high risk, such as the elderly, or those with a history of ulcers. In obstetric and gynecological practice, misoprostol is used for medical abortion, typically in combination with mifepristone or methotrexate. Management of missed or incomplete miscarriages. Labor induction, where it helps ripen the cervix and initiate uterine contractions. And treatment or prevention of postpartum hemorrhage by promoting uterine contraction. Misoprostol works by mimicking the action of prostaglandin E1. In the stomach, it inhibits acid secretion, increases mucus and bicarbonate production, and enhances mucosal blood flow, thereby protecting the gastric lining. In the uterus, it binds to prostaglandin receptors, stimulating smooth muscle contractions and softening the cervix. Dosing varies depending on the indication. For ulcer prevention, the typical dose is 200 micrograms, taken 4 times daily with food. This may be reduced to 100 micrograms if not well tolerated. For medical abortion, after taking mifepristone 200 milligrams orally, 800 micrograms of misoprostol is administered buccally or vaginally, 24 to 48 hours later. In the case of missed miscarriage, a dose of 600 to 800 micrograms may be given orally or vaginally and repeated as needed. For labor induction, a common dose is 25 micrograms vaginally, every 4 to 6 hours. For postpartum hemorrhage, 600 to 800 micrograms is given orally or sublingually, especially in low-resource settings. Misoprostol can be administered orally, vaginally, sublingually, buccally, or rectally, and the choice of route depends on the clinical scenario. Common side effects include diarrhea, abdominal pain, nausea, vomiting, headache, and fever or chills, especially with vaginal or sublingual use. Gynecologic side effects may include vaginal bleeding and cramping. In rare cases, especially in women with prior uterine surgery, it may cause uterine rupture, which is a medical emergency. Misoprostol is often co-administered with NSAIDs to protect the stomach. However, caution is advised when used with oxytocin due to the risk of uterine hyperstimulation. Magnesium-containing antacids may worsen diarrhea caused by misoprostol. Misoprostol is contraindicated during pregnancy when used for ulcer prevention, as it can cause uterine contractions and miscarriage. However, in controlled settings, it is intentionally used during pregnancy for medical abortion, labor induction, or miscarriage management. Be especially cautious in women with prior cesarean sections or uterine surgery, as the risk of uterine rupture is significantly increased with misoprostol use in labor. In elderly or frail patients, monitor for diarrhea and dehydration. Misoprostol is not recommended for use in children. Finally, a word on storage. Misoprostol tablets should be stored at room temperature, between 20 and 25 degrees Celsius, and kept dry, as they are sensitive to moisture. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.